Well, millions in the United States use a CPAP machine to help them sleep, but the FDA has approved a new treatment that could do away with that machine. WWL Louisiana Chief Medical Correspondent Dr. Corey Hebert is here with the details on that and some other health headlines. Good morning to you, good sir.
Good morning.
Looking at that, but you say kind of eat at your own risk.
Yeah, and see, this is one of those things, I have to troll the internet to make sure you guys aren't getting bad information. So, is there a medication that is an injectable that will decrease sleep apnea, obstructive sleep apnea? Yes. But is it new? No. And guess what? It's really only for people that are overweight and have sleep apnea because it's just Zepbound or tirzepatide. So, the GLP-1 you use to lose weight? Exactly. So it's not something new and exciting. It's just that these are the type of things that you're going to see on Instagram or one of those headlines on Facebook, and you're going to say, oh, my God, it's like some new thing. It's not, okay? Don't go down those rabbit holes. However, there is a drug that is a pill that is not out yet. It's called Apnimed, and it's a pill that you would take for sleep apnea. It is in phase 3 trials. It should be coming soon. And that is going to be the thing that's probably going to be the savior from CPAP CPAP machines, but not just the whole concept of the GLP-1 Zepbound.
Yeah,
you fall into these
fine details.
You fall into these traps, man. So you can't do that.
Yeah, also, this is alarming here, looking at the risk of pediatric and adolescent cancer, but associated with medical imaging.
Yeah, so we've known for a long time that if you're a young person, especially under the age of 10, and you get a CT scan, and then you get another CT scan, then that would increase your risk of cancer. Not a lot, but it does increase it. But in the New England Journal of Medicine, a study came out recently, looked at 3 million kids, and they looked at the exposure of x-rays and MRIs, angiography, fluoroscopy, all these things. And we looked at, are those things also contributing to younger children having these types of cancers? And they do, all right? We looked at, there's an increased cancer risk, and if you're between the ages of 5 and 10, then that does increase your risk. But what happens, you get to the ER, your child has some type of sprained wrist or sprained ankle or something, you want a CT scan and you want all these things. Please let the doctors or nurse practitioners make this decision, because if your child has a lot of unnecessary x-rays, angiography, or CT scans, MRIs, there is an increased risk in these malignancies. Not a lot, but it only takes a little bit of an increase, and that could change your whole life if your child gets a cancer.
Yeah, that's something good to know here, just going forward. Also good to know, speaking of scans, got some new mammogram recommendations?
Yes. So this is very important. The American College of Physicians has a new mammogram recommendation. So if you are 40 to 49 years of age, you should use what's called shared clinical decision making. And what does that mean? Talk to your doctor about whether you need to have a mammogram, okay? That means if family risk, possible false positive issues can cause these things to be a little bit of an issue between 40 and 49. However, if you're 50 to 74, they're recommending every 2 years you have a mammogram. Okay, every 2 years. And if you're over the age of 74, not a mammogram at all, just based on your family history and your conversation with your doctor. Shared clinical decision making. It's a really big deal. And there's some other groups that say something else, okay, as far as the recommendations. But American College of Physicians says 40 to 49, based on your history, shared clinical decision making, 50 to 74, every 2 years. And then after 74, just as needed. So that's a big change.
Yeah, a big change, definitely. Well, we do appreciate you sharing that. The doctor officially in this morning.
Right.
Appreciate you, good sir.
Thank you.
And of course, if you missed any of these stories, we've got the entire conversation. It'll be posted on the morning show page of our website, WWLTV.com/morningshow.